Dr. Janish Kothari, welcome again to ITV Gold. I hope you're doing well today.
I'm doing great. Can't complain. Thanks for having me.
Of course, there's so much happening in the nation and we have so many questions. Let's dig right into it. Let's start by looking at some numbers that are coming in today. We're looking at 13.8 million cases in the United States with at least 272,000 deaths. That number was 271 as this day began. It's now already gone to 272,000. My question to you is, how are you processing these numbers right now?
So I'm not sure when you checked your numbers, but right before I got on, I just did a most up-to-date count. And I have that the United States has about 14.2 million total cases with about 279,000 deaths.
Oh, wow.
And to put this into a little bit of a perspective, the entire world up until this point, as opposed when I recently just checked, we've had about a total of 65 million cases and about 1.5 million deaths. So if you do some basic math, the United States has about 21% of the entire world's total cases and nearly about 20% of the world's deaths. So to answer your question, I'm very concerned about these numbers, and I think that when we talked about this previously, when this whole thing began, I think that there's just going to be a continual rise until we figure out a way to reconcile all the mistakes that we've made up until this point and learn from these things.
There is a prediction that there might be 20 million cases total in the United States by January 20th, which is President-elect Joe Biden's inauguration day. Do you agree with that statement? Do you see the number going that much?
I mean, since being on the front lines in the beginning,
right.
I've seen the trajectory of cases, and every month the cases have risen. And up until very recently, we've started hitting all these peaks and all these record-breaking numbers that we haven't seen before. And it doesn't seem to be slowing down at this point. If anything, it seems to be picking up and speeding up. And that could potentially have a number of reasons why that's happening. And I think with the winter months and stuff coming up, it's just a matter of time before we start seeing cases in the 3,000, potentially even 4,000 a day. That's what a lot of the models that I've come across have predicted.
These are deaths that you're talking about?
Deaths, daily.
Wow, that is very, very, very terrifying. When you're looking at these cases, Dr. Kothari, they're surging across the nation, but we're seeing a lot of activity in the Midwest. Why is this happening right now with that region? And when you look at the north here, the tri-state and other states, surrounding it, do you see that problem coming towards us as the winter months, as we go into winter months?
Well, yes. I think that we have to start looking at first why cases are rising, So in the beginning, we started to see somewhat of a kind of a steady number of cases in a day, steady deaths, and then we started seeing this peak. And if you kind of align that with the events that were occurring in the economy, we started reopening the economy. People started getting COVID fatigue. They started shifting outdoor to indoor seating. Schools started opening. Colleges started opening. And I just think overall there's this false sense of security due to massive misinformation. So a lot of these things have, initially started out in the periphery where a lot of, foreign travelers were coming into the coastal sides, and then they started making their way into the middle. And then, people that were living there, they started getting affected. And on top of that, that's being compounded by all the stuff that the economy has tried to do to try to get back to some form of normalcy. So I think there's a multifactorial role that has been played into why cases have started to spike.
But we're looking at months and months of a push for CDC guidelines, Dr. Kothari. We're looking at months and months of people screaming to wear the mask. What do we do at this point? Why can't we contain it still with these guidelines?
People are humans, they're tired. There's a term going around called pandemic fatigue. How long can you keep somebody caged? How long can they sit within their home? And these are very human emotions. And then after a certain point, people are, like I mentioned, having this misinformation. There's information out there that's saying masks don't work and this is a hoax, and all this stuff that's been going on. And some people are easily impressionable, and they're impressionable because they're scared, and that's a normal human response. So I think until we start to educate people and start to continuously educate them, and those people that are willing to become educated, they have to step up and educate those people around them, within their communities, within their own homes, and just try to do everything within their power. Until we get a mass spread of information that's accurate, we're not going to be able to kind of put a cap on this.
Let me ask you something. As a medical professional, what is needed again for the government or several states to shut down? There are some stay-at-home orders already released and announced in California. My question to you is, do you see the need of that happening in several states as we move again into the winter months?
Well, I think that one of the biggest mistakes that we've done so far is that we haven't had a national mandated government plan. I understand why it was done this way. Most our national government doesn't intervene on a state level, and they've given the states their own liberties to kind of decide what's best for their particular state, particular counties, and all that kind of stuff. So what that's led to is a uncoordinated response. Some states had peaks while other states had like kind of plateaus. So when you're not coordinating that, you're going to get a varying response. So I think that was one of the biggest things that we could have done, is to try to coordinate that response.
A lot of these governors are still not putting a mask mandate. My question to you is, after talking so much about the importance of wearing it, how dangerous could this get if people don't wear masks?
We've already started to see the rise, and there are many states that do have mask mandates. If people start lifting these mandates amongst other mandates and other social gathering protocols, there's no way that this goes out. Like when we talked about this early on, we just said that you can't stop this virus from spreading until we find a cure or a vaccine or something along those lines. So until then, the virus is going to be prevalent. It's going to be in the air. It's going to be within people. So until we can find a way to eradicate that, there's no way to prevent it from spreading and spreading astronomically. We have to do certain things to sort of put a Band-Aid on, to put gauze on the hemorrhaging, to slow it down until people much smarter than me, people much smarter than most people out there, people that are experts and professionals in the field that have dedicated their lives to this stuff, until they come up with a plan.
Yes.
We have to do our part.
That's so true. I hope people are listening to you and just following that. Let's talk about hospitalizations, because yesterday we hit almost 100,000 hospitalizations, and the deaths so far, they were beyond 2,000, which was very, very terrifying. The hospital systems are so overwhelmed. What are you seeing in the hospitals right now? What are you hearing, from other doctors in other hospitals? Give us a little insight into what's happening when these hospitals are getting overwhelmed.
So when this whole thing started in March, I was working in New York, and at the time I was seeing like the blunt of all of this. I was seeing so much of these cases on a daily basis. And now that I've moved from New York and I currently live in Pennsylvania, I see a little bit of a difference in how hospital systems behave. Because New York was hit so hard, our resources ran out so fast. Now that I live in Pennsylvania, our cases are slowly starting to go up, but we haven't hit that kind of that critical level yet where our resources are sort of diminishing. But from what I understand and what we get daily to weekly briefings about stuff, we're getting to that threshold where things are starting to get scary. And coming from a place where I know what scary is, right, I'm starting to get those same fears again, that what happens now if we run out of PPEs and ventilators and beds and stuff like that. So all across the nation, some states have absolutely no ICU beds left. Other states are trying to make more ICU beds, and even those are starting to fill up. So these are the things that are overwhelming our system. And I just think that we need to do something to kind of stop this until we can. I don't know if we can survive that next surge, or we're still in that, but that next peak.
So, wow. So some people are saying that we may or may not have enough PPE supplies for the second surge, but you're already concerned about it because you are seeing it sort of go out of hand. When you're looking at Thanksgiving, Dr. Kothari, and you're looking at the surge of cases, how much of that do you think is related?
I don't think it's related just yet.
Okay.
And to explain a little bit about why that is, when we do have a good understanding about how the disease works. We know that there's an incubation period about 5 to 14 days. So considering that Thanksgiving was a little less than a week, or 6-7 days, something like that. So the people that are getting sick, they're probably right in the beginning phase, or they haven't started yet, right? Because we're not 2 weeks out. So I don't think we're going to see the absolute numbers from Thanksgiving until another 2 weeks to maybe 4 weeks when we start seeing the really sick people get on these ventilators, and of those, even the sicker people that potentially, face their demise because of this disease. So I don't think we've seen it yet, but we know what happened during Thanksgiving, and people started getting together like they have been. So I don't think we've seen the effect of it yet, but I think it'll come. Those numbers will come.
Do you think, again, we'll see the hospitals so overwhelmed that they're not able to do anything else but just take care of COVID-19 patients? Because that happened a lot in the beginning of the pandemic.
If you mean, will we see it again? Yeah. I would like to say that we're seeing it now. Some places have that issue already. Some places, there's a lot of physicians that I follow on like social media and like certain forums and stuff that I read and engage with. Right. And they're already saying that we don't have enough PPEs. We don't have enough beds. Our nurses are sick. Are sick. Our doctors are sick. Some nurses are having to take care of 8 patients, which is unheard of, especially at a critical care level. So some states have already started to feel that. And this is something that I was feeling early on in March when I thought at that time it was bad. And it wasn't as bad as it is today. So I can only imagine what that level was like. I remember walking those halls and seeing, like these beds that were, these rooms that were only supposed to have 1 patient, they had 4 patients in them because there just simply was no space. And that was at that time in March, April, May, or whatever, So now that we're seeing it with these cases rising, I can only imagine what those states are like.
Currently, according to you, when you're looking at this, the crisis in the healthcare system, what is currently needed, Dr. Kothari? From the state level and the federal level, what could really help these doctors that are truly struggling and healthcare workers that are struggling?
I think it goes back to having that coordinated effort. I think it has to come from the top, and mandate things and some form of like being reprimanded for not following and complying, because now it's coming to a point where it's affecting like humankind. It's not just individual people. It's affecting us as people, as an entire race. And this is a global issue. So, if we mess up on our end, it could potentially affect another country elsewhere, right? We're not having travel restrictions and bans and things like that. To draw a little bit of a parallel and paint a picture, if you look at the American population, we have 330 million people. Right. Africa has the entire continent has 1.3 billion people. And like we just said, we've seen about, 14 million total cases. And we've had about 279,000 deaths. Right. Africa has only had about 50,000 deaths. Why is that? What did they do differently? So I actually looked into this, what they did differently. And before they even had their first case, they had stopped restrictions. They had put travel restrictions in so people couldn't come in. Wow. And why did they do that? Because they already went through a pandemic with Ebola. They already seen what, this horrible disease can do to them. So they already had formulas in place. Mm-hmm. They had like these small villages where local village people would stand at the entrance of their village and temperature checks, because they took it upon themselves. Small communities with very limited resources took it upon themselves to take matters into their own hands, because who knew when government would step in at that time to help 1.3 billion people. Yeah, that's so I think that the help has to come from the top down, from the state level, from us as individual people, and even if you can make as small differences within you and amongst your own friend circle. Right. So there's certain countries that have had success.
Yes, for sure. What's your message to the incoming administration? Because they'll literally inherit this at possibly the worst time as we're looking at almost 20 million cases as the prediction comes.
It's tough. I mean, I can't imagine what it's like for this administration to come in. It's a very steep uphill climb. And I think their first step is to have to make up for the deficiencies of this previous administration and make strides to reconcile the mistakes that were done. And were they mistakes because a lack of effort? Were they mistakes because of lack of knowledge? Was it a combination of these things? Since the beginning of all of this, we've learned a great deal, and we're continuing to learn a great deal. So I think the biggest thing that this administration can do is listen to the people in the position of knowledge, the people that have devoted their lives to, make a difference. The people that have devoted their life to healthcare. I'm not a politician. I'm not the smartest scientist in the world. But if I was a part of this administration, that would be my first move, to listen to the people that have a plan.
Yes, definitely. Let's now talk about something good that we are hearing this week and something that's very promising, the vaccine. I have so many questions for you. Just today, the United Kingdom has become the first country to approve the Pfizer Inc. and Biotech Inc.'s vaccine. My question to you is, what insight do you have about it? And it's showing really high efficacy and it's showing that it's very efficient, but looking at the number of people that were part of this trial, do you think that's enough? This is a two-part question, yeah.
Right. So before you understand what this vaccine is doing, you kind of have to understand a little bit about how vaccines work and how the human body fights illness. Whenever you get a germ, a virus, a fungus, or whatever foreign body that goes into us, right, our immune system has to make a reaction to it. We have to find a way to stop this infection in its tracks. So we have red blood cells and white blood cells and all these other immune cells that collect this host collect this infection that's come into our body, and we make antibodies. And this takes time. And sometimes it can take days, sometimes it can take weeks. And just in case we get reinfected with the same thing, our body's ready. And I always kind of explain to my patients when they ask me about vaccines and how the immune system works is if you're a person that's going into a club without a bouncer, you can just get in, Yeah. But if you're somebody that's going to go inside and create trouble, the next time you come to that same club and there's going to be a bouncer outside, chances are you're not going to be able to go in because that club has learned. And that's kind of what the immune system of our body is. These immune cells are the bouncers. They don't let foreign invaders come in and just wreak havoc. So what these vaccines are doing, they're very innovative, and a lot of people have hesitations about vaccines and concerns about catching the illness and all that kind of stuff. I'm sure you've heard of it. Yeah. So these vaccines are great because the Pfizer and the Moderna one, they're mRNA derivatives, which basically means that this is a genetic code that's made from the virus. It's not the actual virus. It's these protein components, and this is a messenger RNA. It's a form of genetic code, and it's delivered into our body, and our body's immune system reads this genetic code and it transcribes it into proteins that we can use. So just in case we do get infected with that virus, that bouncer is already there. So that's basically how it's working. And what these studies did, usually when you make a vaccine, it takes 3 to 4 years because you got to go through rigorous trials, and there's always errors along the way, and you have to go back to the drawing board and kind of redo things and retweak things. Right. And you have to look at safety protocols. You have to make sure you have the right amount of people, and you have to go through different phases and kind of do these studies. So with these trials, we have a total of 100,000 patients that have been enrolled. So that's about 200,000 doses of vaccines have been given out. Right. To put that into a little bit of a perspective, when the Ebola epidemic in Africa was going on, their studies only had about 15,000 patients. And then when they were doing trials for the shingles vaccine, they only had about 15,000 patients. So to put that into perspective, we have 100,000 patients that have been tested on these vaccines. Until date, we haven't seen any adverse events. Wow. A lot of infectious disease specialists and people that make vaccines, they know that most serious side effects, adverse events come within 6 months. So we're at a little over the 6-month mark since when these trials have begun, and they haven't recorded any serious adverse events. So with all that being said, it puts a lot of promise into this vaccine or these vaccines. And the efficacy is around a little over 90%. To put that into further perspective, the annual flu vaccine that we often get is only 40 to 60% efficacious. So these are really good numbers. And it really paints a picture into the development of vaccine. Does it always need to take 3 to 4 months? Maybe in the future, if we do, God forbid, come across another pandemic of this nature or even worse, we kind of know all the gears are in motion. We kind of know how to attack this in the future. So, yeah.
So, again, my question to you is this timeline, just, the amount of time it's taken to come up with this vaccine. We are expecting Pfizer on December 15th in this country, and we're expecting Moderna on December 26th. have we given this enough time according to you, or should we wait? Should there be even more trials done? And do you think the UK is rushing right now?
That's a tough question to answer, only because normally this is uncharted territory, right? Like we haven't conquered something like this before, at least in my lifetime. We haven't seen something like this before. And never in the past has there been an event where the entire globe kind of comes together with the advent of technology that we have, with the ability to communicate on such a grand scale at the snap of a finger. One of the biggest pandemics that we've had is polio, where like 500 million people were affected. Right. That vaccine took a while to create because the technology didn't exist. The advent of like communication across trans-global landscapes wasn't what it is today. So I think that now that you have the smartest people in the world from every corner of the globe are working on one singular focus. Yeah. So that in itself should provide a little bit of a confidence in the timeline, and the results speak for themselves. Yes, unfortunately, we are also in a position where time is of the essence. Human life is of the essence. So, and people are wondering about the long-term effects and all that kind of stuff. And unfortunately, because it's a pandemic, we don't have the luxury of waiting years and years that most vaccines often have to undergo for these rigorous testing. So I think we have to find that perfect balance between what's working and what's needed at this time, and while weighing the risks of it.
Will you, or do you know somebody that would be one of the first, receivers of this vaccine in the healthcare industry?
What they're saying right now is that healthcare workers like myself, other people in like first line, nurses and people that work in nursing homes and stuff, these are the people that are going to be administered this first, because you have to protect the help so they can help, right? So I personally, I believe, I'm a man of science. I've said this from the beginning since we first started having these interviews. I believe in the scientific method, and I believe that the people that are in the positions of making these things are far smarter than me, and they also believe in the scientific method. Right. So for me, I'm going to be one of the first people on the lines to take this vaccine. And, hopefully the next time we talk, I'm going to have very positive things to tell you about how I'm feeling at that time. I just think that I have to put myself in this position, because if your caregiver isn't going to do that, why would you listen to your caregiver telling you to do that?
Yeah, that's so true. Will you recommend this vaccine, if you take it, to everybody else?
I think that everybody has their own rights. It's your body and you can do what you want with it. But I think you have to consider the ramifications of not. I'm a big believer in herd immunity, and that's what vaccination is. You're not only taking it for yourself, you're taking it for your neighbor, for your loved one, for your spouse, for your children, for the people you work with, whatever it is, and I've always come across this idea that young people don't like to take vaccines because they say, I never get sick. But it's not about you. It's about you protecting the people around you. Yeah. And back in the day when we talked about, last time we talked, I had kind of alluded to the idea of like, young people had to go to war in the past to like fight for their country and stuff. And this is not akin to that exactly, but we as people have to do our part now, and try to create this immunity and prevent the people that are most at risk from getting further affected and costing their lives.
Yes, I just have a couple of questions left here for you. The first one is very popular on the show. When you're looking at the South Asian community, Dr. Kothari, and you're looking at, high cases of heart diseases, lung diseases, diabetes, what are you watching for them right now? And what do they need to truly do to make sure they are protected?
So my take for South Asians with comorbidities that you've mentioned is pretty much my take with all people with any comorbidities that put them at high risk. You have to take care of yourself and your loved ones. And, if there are people in your family that are hesitant or doubtful, do your best to educate them about safe practices. I think that the information is out there what to do to protect yourself. And we know it works. It's not a perfect plan. It's not foolproof. There's going to be, bumps along the way, but we have found things that have shown benefit. And I always think about it, let's just say we didn't do any of this stuff. We didn't have masks. We didn't have these social distancing guidelines and all these other restrictions. What would the numbers look like?
Yeah.
So I would just say to continue doing what we've been doing. And if you haven't been doing it, start.
Yeah, that's so true. Do we have enough testing in the nation right now, according to you?
So the most recent research that I've done, it's basically saying that we're starting to get to that point again, that we're running out of tests. I think in the beginning of November, when I last looked at this, November 13th week, we had used about 10 million tests in the United States alone. And I'm sure it's gone up since then because the cases have gone up. So you must have been testing a bit more. So we're going to get to that threshold again. And when people think about the lack of testing, it's multifactorial. It's not the exact test for COVID itself. It's the pipettes that you use to take the little fluid out and put it into the test tube. It's the test tube. It's the machines that you're using that maybe can only house 50 tests at one time. They can run out, or you're using them so much that the machinery breaks, or the places that you're storing the reagents that you use to make these tests or apply these tests, they're running out. There's so many things along the way. Gloves and masks that people are using, or whatever protocols these labs have. There's so many things involved in the testing process that are running out.
Yeah.
And companies that make this, they simply can't keep up with the demand for every country.
Wow. That's that's something that people don't even think about here when looking at so many things. Another question that I have here is another popular one. Indoor dining is still open in many states, and some people have capacity for it, some people just don't have it. What is your take on indoor dining or indoor activities? Should people be doing it with mask on, without mask on? What's your take?
I mean, like I said, people want to get back to normalcy, and I understand that it's a human desire. It's a human need. Like we like social interaction. That's pretty much what separates us from other animals. Like we like this interaction. I just think that if we continue to keep doing that without keeping all the things that we've discussed so far in mind, the people that we're sitting at that table with, God forbid, one or two of them might not be there. And is it worth that? That's kind of what I think about. I think that we've started to see these cases start to spike up again once we started opening up the economy. Once we started, going for this indoor-outdoor dining, and once we started slowly lifting up the social distancing rules and all that stuff, and we saw what happened. Yeah. The spikes just didn't come out of nowhere.
That's so true. That is so true. How are you looking at schools and universities in that sense? If parents are still debating between virtual and in-person school, how have you observed all of that?
So I think the school systems have played a pretty significant role in the spread of the virus. I mean, and this is also multifactorial, as pretty much everything along this whole pandemic has been, asking school-age children or even as old as college kids to change their way of living in order to have a positive impact and for a greater good is a pretty tough task to do. Youth always has this idea that they're invincible, and it doesn't help that there's mass propaganda movements out there that suggest that this illness only affects certain ages or certain demographics. So a lot of these kids aren't doing their own research. They're falling into the social media clickbait. And that must be the information. I read something here that masks don't work, whatever the case may be. So I know it's a tough situation as parents and educators, but I do think that limiting social interaction as much as possible to reduce these sort of like youthful urges will prove to be effective. And that calls into question something else. A lot of the kids, particularly the very young ones, they're at very critical stages of their life, right? Yeah. They're at the point where social interaction is important. It helps developmental skills and like communication skills and just intelligence in general. So it's a tough question, and I don't have the answer to that. Yeah. But I think right now, when we're seeing spikes, it's coming from somewhere, and everybody's playing a little bit of a role in it.
Yeah, and people really need to see that and understand that's so important. Finally, my last question to you is two-part. What are you watching the next couple of months as a doctor? And second one is, could you please give some advice to our audience on what they should do next?
what I'm watching for in the next couple of weeks to months is I'm expecting a very large rise because a lot of it, we talked about this before as well. We think that we know that a lot of viruses tend to have increased prevalence during colder months. And they do studies on this because the lower temperatures and the humidity changes allow respiratory particles, when we sneeze and all that stuff, to be suspended in air a little bit longer. And when you're colder, you're standing inside more, right? Because you're not going outside, and so inside's always smaller than outside. So you're in much more closer quarters, whether it's with families or at work and school and all that kind of stuff. So there's going to be a definite rise because you can't avoid being out. You have to avoid being outside in the cold. So I'm expecting that, and I'm scared about that for sure. I'm scared about that, and particularly as healthcare professionals, because I don't want to have to get to that point again where I have to tell a wife or a husband or a daughter or son that I can't help their significant other, their loved ones, because I just don't have the resources, and I just don't know what to do anymore because the things that I've tried don't work. My advice to everybody out there is, continue to do everything in your power to protect themselves and their loved ones. Educate yourself every day about this disease and what it's doing to the economy, what it's doing to the healthcare system, and do the best that you can to educate those around you that won't educate themselves. They might not listen to me because they think, oh, he's a doctor, he has a stake in it or whatever, but they might listen to you because you went to school with him, or you grew up with him on the same block, or you played in the same basketball team, whatever it is. They might listen to you more than they might listen to me. And I think that we're all in this together as an American people, and most importantly as a human race. We're not just Americans, we're people from other countries are also being affected by our actions, So, and I just don't know if we're at the peak or we're at the bottom of the mountain, still working our way up until we see it. I unfortunately don't know. And I just don't think we can get out of this on our own. And I think that we're going to need the help of each other and one another. And I urge and implore everybody to listen to the warnings of people that are much smarter than me. The people that are making these policies, and the healthcare people that have provided all these warnings over all these months. So I just think that they should start taking this very seriously.
Yes, for sure. And just wear a mask. I think a lot of doctors just keep pushing on that. So important.
I say that so much, it's just like word vomit nowadays.
Wear a mask, everyone. Well, thank you so much, Dr. Janish Kothari, for your time here.
No worries. Thank you. Until the next time.
Yes.